In this video we're going to have a look at the lateral hip strength series. As opposed to lateral hip control, we're interested in the ability to produce higher levels of torque around the abductors and external rotators of the lateral hip. This is extremely important in function, especially athletic function. During change direction, we're looking to produce larger amounts of force in the frontal and transverse plane. An assessment of lateral hip strength and control might be manual testing, use a handheld dynamometer or isokinetic dynamometry, or alternatively look at a single leg squat, which is an excellent assessment relative to body weight and lever length. We're looking for a neutral trunk, pelvis and knee position in the sagittal plane. Common deficits that we often see are increased knee valgus and trunk sway occurring concurrently, some pelvis on hip internal rotation and femur internal rotation, or alternatively external rotation of the foot to try and compensate and shorten the hip external rotators, making control even easier. The importance of these muscles in relation to athletic groin pain really comes into multiplanar and higher speed movement, when compensations, particularly during change direction, see increased trunk sway or loss of centre of mass control relative to the stance leg, and as a result increased stress and strain through the structures of the medial and anterior hip and groin. The entry-level exercise for the lateral hip strength stream is the banded abduction external rotation in squat position. Here we place mini bands either side of the knee to generate an abduction and rotation force for the hip muscles to resist against. We descend into a squat position so the thighs are parallel with the floor. Make sure that the back is in a neutral lumbopelvic position and the shoulders are pinned back. From here we abduct and externally rotate the hips against the resistance of the bands. Common errors are to slightly flex the lumbar spine while resisting, or to stand up while carrying out the exercise. We want to maintain those thighs parallel as we abduct and externally rotate the hips. Another common error is the inability to maintain a neutral or quiet foot position during abduction. Here you can see the foot compensate by inverting and rolling onto the lateral border of the foot. It's essential that we keep the foot nice and quiet and that the rotation happens only at the hip joint. The regression within this stream is to reduce the resistance by lowering the number of bands around the knees, or alternatively minimise the depth that's descended to during the squat. The progression is to add additional bands while the thighs are parallel to the floor.